Dr. Kieran Moore, Medical Officer of Health for KFL&A Public Health, will appear before Council to provide a briefing with respect to COVID-19 in the KFL&A area. I see that Dr. Moore has joined us live on Zoom. Dr. Moore, thank you, first of all, for joining us this evening for the briefing. And if I can also say on behalf of City Council and our entire community, thank you for your leadership, to you and your team for all the great work that you've been doing in our community fighting the fight against COVID-19. Dr. Moore, the floor is yours.
Well, thanks very much for the opportunity to speak with you this evening and through you to our community. I believe Derek's going to handle my slides, so thanks again. I do want to acknowledge that this is a difficult time. This is a stressful time for many. And I believe as a community, we are working better now together, collaborating, coordinating, communicating with a common goal to reduce the effect of this virus. And I have to celebrate that. I'm truly been humbled by the work that we've done together as a community to limit the spread of this virus. I also want to acknowledge that I understand that many have made sacrifices economically, socially, to limit the spread of this. And I very much appreciate the sacrifices many in our community are making. And I hope that they won't last too long, these sacrifices that many are making. But we must all remember that we're in this together, that each one has a role to play, that we will get through this. There will be bumps along the way. It is a difficult task to fight a new virus that wants to spread so rapidly in our community. But I believe, given what we've gone through in the last several months and the great coordination and collaboration that's happened, and how well our community has risen to the risk of this virus, that we will get through this well. And I have data to support that I'll present to Council this evening. And again, thanks very much for the opportunity. So the title for this is The New Normal. And we will have to change how our world works to deal with this virus as it is not leaving us. It's going to want to stay and to come back on a seasonal basis. And so we have some recommendations on how we can deal with that. So Derek, if you could move to the next slide. My goal today is to review just quickly on the background of what we've done to date and have to celebrate the work that the City of Kingston and our Lennox and Addington and Frontenac has done to work with us on this issue, go through some of the timelines. What do we mean by the statement about flattening the curve? Talk about a chain of protection, and that's basically the role that everyone has to play to limit this virus on our community, and talk about some of the action we've taken to date, and then talk about the future. How, as a community, can we work through this and get to the other side, and how long that may take. So next slide. So just as a reminder, this is a brand new virus to us. The science is evolving. Our belief is that this is spread by contact and droplet. It's not spread through the air in general. And so you must be in close personal contact with someone who would sneeze or cough on you to spread this virus. And we've learned that through multiple studies from China, that it is the highest risk is in close personal contact. The commonest symptoms are fever and or cough and or increased difficulty breathing. But at our assessment centers now, we will expand that to include a new sore throat, a new laryngitis, a new cough, and or sinusitis or runny nose, etc. So we've expanded the symptoms to be even more inclusive and to test more people. And that's an important message for our community. Generally, it takes around 5 to 7 days for someone to start developing symptoms if they've caught the virus. And that can be as long as 14 days. And if you get the virus, some people will shed virus before they even develop symptoms. And on average, people will stop shedding virus around 7 to 8 days, but we extend it all the way to 14 days to minimize the risk of subsequent spread of virus in the community. And that's public health's job. If we get a positive person with a positive test, we will contact them We will advise them on a daily basis, and we will follow those individuals up and review what contacts they've had into the community and limit the spread. And that's worked very well to date. I got to applaud our public health nurses who have been turned into public health detectives to limit the spread of this virus in our community. Next slide. So we have been planning for pandemics all along. It's a core function of public health. And just this August of 2019, we had a major meeting of all of our partners, 100 people at KFL&A and our sister health units with our paramedics and our acute care and long-term care partners. So we do have plans in place that we dust off and work through and have implemented for this new COVID virus. We went into what's called incident management mode, where we respond as an organization to this risk in late January, and then had educational sessions in March to prime our health system partners on how to respond. And then on the 26th of March, I got to applaud all of our municipalities in KFL&A declared a state of emergency locally to help support the actions that we needed to protect our community against this virus. Next slide. The chain of protection is really a theory that everyone has a role to play in protecting our community. And I just have to celebrate all of these organizations, both school boards, colleges, universities, health system partners, multiple levels of government, corrections facilities, those that work with vulnerable and homeless individuals, families. We have partnered to strengthen this chain of protection across KFL&A. And as a result, I think we are better off in our response because we've had a comprehensive community-wide approach to this virus. And again, I want to thank all these organizations that we've partnered with. I have to celebrate the work that they've been doing. The city's done great work, both for vulnerable, for homeless, and working with us by allowing us to work at the Memorial Arena, where we provide assessment of patients. It's been a great partnership, and I hope and expect it will absolutely continue. The next slide. In terms of flattening the curve, this is a theory. So if you look at this dotted line, that's what numerous areas of the world are experiencing. If you include New York, many cities in the United States at present, as well as Northern Italy, they had very little control of the epidemic, and it basically had a significant health impact on their community with high morbidity and high mortality. We have learned from those areas, and our province has enacted the Civil Protection Act, which quietened and dampened and flattened the curve. So what we're seeing in KFL&A is we've gone through our first epidemic curve. It peaked on April 5th. We had around 50 patients, mainly those that are repatriating and returning travelers that brought COVID-19 into the community, but because of our combined efforts of our community, it did not propagate significantly. And we went through that very first wave without any significant impact on the healthcare system. We only had a few patients admitted to the hospital, and most did very well at home and have recovered fully. But it's important that our community understand, because we've dampened the wave and we didn't have a significant rise, we will have ongoing small outbreaks that public health will work with our health system partners to minimize its impact on our community. This virus will not be eliminated. It will have to be lived with, and we'll have to try to get back to some type of normalcy while we control the effect of this virus on our community and limit its effect on the most vulnerable, which are our elderly, those over 70, those in long-term care facilities, those in corrections facilities, those in group homes, etc. So our strategy has worked. We've already been through one wave, and I have to tell you, and through you to the community, that we will go through other waves. It will go in a small undulation, and it's our combined responsibility as a community to limit its effect. And our community has risen to this occasion. They've done appropriate social distancing, physical distancing, hand washing, staying at home if you're sick, get tested if you have the symptoms consistent with COVID-19. The system has worked locally, and as a result, we haven't had significant impact on the health system. We haven't inundated our emergency departments like other communities have suffered. And to date, and I'm knocking on wood, we've had no deaths in our community, which is something we should celebrate today, only because we've worked so well together as a community to limit the effect, both on our most vulnerable and in our long-term care facilities to date. Next slide. So I want to draw your attention to our website at kflapublichealth.ca, so kflaph.ca, where we provide transparently our updated data. And this was as of 3 o'clock. I'm sorry, it updates at 4:30. We now have 59 cases, with only 5 still in the community. 54 have completely resolved their symptoms, and 1 person is in hospital and stable at present. And again, we have no deaths in our community. And I have to celebrate that this is only because we've worked together so well, communicating, collaborating, and coordinating. The last week, we've only seen 1 or 2. So if you can imagine, that is our first wave that's shown to you on this slide. It's different around us in Toronto and Ottawa. Toronto is going to peak later this month, and Ottawa is still, their numbers continue to rise, but we have gone through effectively our first wave and are in a recovery phase. And I just need to let the community know this virus will come back, but we will, through our combined efforts, control how it enters and limits its effect. Next slide. This is just showing you numerous epidemic curves, so incidence of disease over time. We've highlighted here in gray where New York is at, which is at a very high frequency of increase. Italy now has finally peaked in incidence. Canada was increasing steadily, and Ontario's epidemic curve is starting to flatten, and Kingston flattened roughly 2 weeks ago. And has remained steady state. And it's our goal to continue it as a steady state, low incidence area. Next slide. I also want to thank once again the City of Kingston for letting us use the Memorial Center, where we've been assessing from 80 to 100 patients a day on average, and a high proportion of them have been tested now that we have greater testing capacity, and also that Lennox and Addington Community General Hospital has been a great partner in early assessment. And together, I think having early assessment centers has really helped us detect cases early and allowed our nurse detectives to try to limit the spread in our community. Next slide. Because we have enabled these assessment centers, our hospitals have been working diligently to increase their capacity, because part of our purpose was to minimize the effect on the acute care sector. So I have to also celebrate Kingston Health Sciences Center has done a remarkable job of increasing the number of beds that are available. And as of this morning, although the numbers fluctuate, it was around 123, and they've made a great progress increasing the number of ventilators and critical care capacity at Kingston General Hospital. So this community should be aware of the great work that's been done locally, as well as at Lennox and Community General Hospital and Providence Care Hospital. All these partnerships have worked cohesively. Providence Care Hospital has made available 174 additional beds if they are required. Hotel Dieu we're working on that site on increasing bed capacity. And so we would have Kingston General Hospital as sort of a hot site where COVID patients are assessed and treated, and critical care resources are provided. And then any other additional care can be provided at Providence Care Hospital, and a cold site where you provide care to other individuals with other illnesses at the Hotel Dieu site. And then we're working on also building capacity through the concept of a field hospital. So it's very important that this work that our community's done to limit the spread has really enabled our health system to prepare and to respond to this new threat. This work has been done diligently and thoroughly, and I'm very impressed with the work led by Dr. Pecora at the Kingston General Hospital and Kathy Szabo at Providence Care Hospital. It's been remarkable progress on making that increased bed capacity, where we were full to the rafters prior to this occurring, and now they've enabled this so that our patients in our community can be provided the right care at the right place at the right time if needed. But at present, as we've said, we've done a great job at limiting the spread of this virus in our community. Next slide. I also want to celebrate, and these are good news stories, our paramedics, both in Lennox and Addington and Frontenac. We've partnered with them so that they can do swabbing at someone's home if required, and we're encouraging them to apply for funding for community paramedicine work. And paramedics have worked at our assessment center with us to seamlessly provide care to individuals and to help us with transfer or transport if and when required. And they've been great partners as well. Next slide. Our long-term care and retirement homes, again, have been a priority from us from the start. We have at KFL&A Public Health assigned a public health inspector as well as a public health nurse now to each facility so that we can support them for infection prevention and control, for outbreak management, and to give them guidance on care of any patients that are diagnosed with COVID-19. I have to celebrate that our teams worked very early and that we've had only 2 outbreaks to date, one in a healthcare worker and our one case in one patient who's currently receiving care, and we've not seen any propagation outside due to our combined efforts working with Kingston Health Sciences, Providence Care Hospital, and our long-term care partners. So that's a remarkable position that we are in to be able to celebrate how limited the spread has been in those institutions which are vulnerable. Next slide. The story across the province, though, is different. As you see in the blue line, these are the cumulative number of cases of residents in long-term care facilities across Ontario, the cumulative number of staff that have tested positive, and sadly, the number of deaths that occurred in long-term care facilities. It remains a high vulnerable area for us. We and KFL&A and across the health system are working diligently to continue to protect that vulnerable population, and we will be continuing to do that day in, day out. You have our assurance. Again, I'm struck and humbled by how well we are working together to protect these populations. Next slide. We are also working at Correctional Services. So we in KFL&A have over 2,000 inmates in the federal corrections facilities and over 200 in our provincial facility in Quinte in Napanee. So we've been partnering with them to provide the same resources of infection prevention control and outbreak management, surveillance, and testing of individuals within their jurisdiction. And that partnership has been successful. We've had, and I'm knocking on wood, no outbreaks in these facilities, and yet there are numerous outbreaks across the country. So again, have to salute the work that's been done to date and the partnerships that have been established. Next slide. Planning ahead, clearly, the only way we can reduce the impact of this virus is either we acquire immunity through having been infected, and that's not the best means of acquiring immunity. That would take around 70% of our population on average would have to get a natural acquired immunity to this infection to limit its spread. So 140,000 of us in KFL&A. That's not an option. And so we are anticipating having the production of a vaccine, but that is still 12 to 18 months away. And clearly, from a public health vantage point, we wouldn't endorse a vaccine till we knew with certainty that it was safe and that it was effective. And it would have to meet our standards, our very high standards for vaccines to be given across to a population. So we will continue to monitor the effectiveness of vaccines and their creation and their research and their publications, but this is still a long ways away. So we have a journey together as a community to make over the next 12 to 18 months, where we're going to have to be vigilant. We're going to have to continue to work so well together to protect the virus entering into our community. Next slide. The new normal will be the maintenance of physical distancing, social distancing, hand wash, hand hygiene, staying at home if you're sick, getting tested for COVID if you develop any respiratory illness with any symptoms. That's going to be our new normal, and potentially wearing a mask in public if we can't maintain physical distancing. That will have to continue for the next 12, 18, 24 months until such time we get an adequate treatment and or an immunization. The WHO has created criteria, and these have been validated by the Public Health Ontario, Public Health Agency of Canada, and the CDC as criteria by which we can start transitioning and opening up our economy in a phased, reasonable, prudent, and slow manner. I would point to you that it's my belief in KFL&A that the transmission has been controlled to date. We have been through our first wave. We haven't had any significant rise. We've been able to use public health measures to limit its impact in our community. On point number 2, and the health system has significant capacity, we still need personal protective equipment. We only have a week's supply locally and across Ontario. So that basic equipment still needs to be improved. And we also need better access to testing. We have maybe a week or 2 supply for adequate testing, but we could potentially run out of some of the components for testing. So personal protective equipment, testing capacity, and treatment capacity are still issues, because we've heard from our critical care experts that they may not have all the medications they need if we get a sudden ramp up in need for critical care resources. We, on point number 3, I think we've worked very well together in protecting our long-term care patients and those in vulnerable settings in our corrections facilities and in our shelters. And for point number 4, we still need, if industries are going to return, to work with them to create preventive measures to prevent spread in their settings. And point number 5 is about imported cases. So our borders will have to remain closed for a prolonged period of time if we're going to limit international spread. Certainly the Americans in the United States have a much higher incidence than we have right now, and have a much higher percent positivity in all of their tests and a high impact on their health system right now. So that protection will have to remain in place. And I think 6 is very important, that we engage our communities, understand the role that they have to play on protecting and adhering to those social and physical distancing rules, and understand from them how we get back to our social and economic life. But again, that has to be in a phased, reasonable, prudent, controlled manner. And we're not there yet from a health systems vantage point. Next slide. So, I mentioned these issues already in terms of recovery plan. We have to deal with these health system issues, and we hope that the supply related to these components will improve over the next several weeks to month. And next slide. So my key messages are that as a community, this virus isn't going away, but want to thank the community for having been so diligent in adhering to social and physical distancing. We should continue to stay at home unless you have other important issues to do, to go shopping, etc., especially if you're over 70. Continue our good hand hygiene, our physical distancing. We must be very sensitive to vulnerable members of our community and continue to include them in our chain of protection, and that we must continue to be vigilant to protect our community against this aggressive virus. We will get through this. We have done a remarkable job to date. As a community, I have to applaud everyone's efforts to limit the spread of this virus, and we will come out the other side of this stronger. but I just can't tell you when. And again, want to thank Council for the opportunity to speak with you today, and I'm happy to take any